for prevention of recurrent Clostridium difficile infection. Well, first of all, what's Clostridium difficile? Well, it is the most common cause of infectious diarrhea in hospitalized patients. Recurrences are common after antibiotic therapy, and it appears all around the world. Well, here's a video of what it's about if you wanted to watch it later. Then, what was done on the trial? Well, scientists conducted double-blind, randomized, placebo-controlled phase 3 trials. Modify 1 and Modify 2, it involved 2,655 adults receiving oral standard of care antibiotics for primary or recurrent Clostridium difficile infection. Participants received an infusion of Bezlotoxumab and Atoxumab plus Bezlotoxumab or a placebo. Atoxumab alone was given in Modify 1. Well, this is important because first we need to know what is Bezlotoxumab, and as well as Atoxumab. It's a human monoclonal antibody designed for prevention of recurrence of Clostridium difficile infections. And what does it do? Well, Bezlotoxumab, it's a film monoclonal antibodies which binds Clostridium difficile toxins A and B respectively. Also, Bezlotoxumab specifically inhibits CROP domain of the TCDB. It recognizes a specific epitope in toxin TCDB and has a high affinity for that regions, which eventually kills the bacteria. And well, about this med, there are obviously pros and cons, but it's important to know that before it was discovered, there was no effective way to treat Clostridium difficile or prevent the recurrence of an infection from it. So, well, as you know, it has a significant effect in preventing recurrent infections for Clostridium difficile. The good thing is that it is FDA approved and that you can find it all around the world. Nonetheless, it is not 100% effective as any drug, and since it was just approved in 2016, it will take some time for it to be available in public health centers. And in Ecuador, Clostridium difficile is a highly recurrent infection in Ecuador's hospital. However, since the FDA just approved it in 2016, it is still a little bit hard to find it in public health facilities. Nonetheless, it will be hopefully available soon all around the country, so we can prevent this in hospitals. And well, in conclusion, Bezlotoxumab is the best option currently available in the market for preventing recurrent Clostridium difficile infections. Although it's a new product, it has shown outstanding results, hence it should be used in all the hospitals around the world, and hopefully it will be. And well, here it's a video which is going to explain more about it, so please hear it.
Clostridium difficile is the most common cause of infectious diarrhea in hospitalized patients in high-income countries. After treatment with antibiotic therapy, patients may have a recurrence of C. difficile infection, which can be more difficult to treat and may lead to rehospitalization. Circulating antibodies against toxin A and toxin B generated by C. difficile have been correlated with protection against primary and recurrent infection. Modify 1 and Modify 2 are two international randomized double-blind placebo-controlled trials investigating the effect of monoclonal antibodies against C. difficile toxins to prevent recurrent infection. Investigators evaluated Atoxumab and Bezlotoxumab, two fully human monoclonal antibodies that bind and neutralize C. difficile toxins A and B respectively. 2,655 patients with a median age of 66 years who had primary or recurrent C. difficile infection and were receiving standard of care antibiotics were randomized to receive intravenous placebo, Atoxumab, Bezlotoxumab, or a combination of both monoclonal antibodies. The primary endpoint was the proportion with recurrent C. difficile, a new episode after successful treatment of the initial infection, over 12 weeks of follow-up. After an interim analysis, enrollment in the Atoxumab group was stopped owing to higher rates of recurrent C. difficile infection than in the combination monoclonal antibody group. In Modify 1, the number of patients with recurrent C. difficile was 17% in the Bezlotoxumab group, as compared with 28% in the placebo group. The results were similar in Modify 2, and the differences were significant in both studies. The rates of recurrent C. difficile infection were similar in the Bezlotoxumab and combination groups. Common adverse events included diarrhea and nausea, which were similar across all study groups. The authors conclude that among patients receiving standard of care antibiotics for primary or recurrent C. difficile infection, Bezlotoxumab alone or in combination reduced recurrent C. difficile infection rates as compared with placebo. Full trial results are available at nejm.org.